Hello, everyone, and welcome to another episode of Arthritis at Home. Today, we're going to preview what's coming up for ACE during Arthritis Awareness Month in Canada in September. And to join us today to look at ACE's upcoming programming and survey results are ACE's President, Cheryl Koehn, and Ellen Wang, ACE's Program Coordinator. Ellen, Cheryl, welcome.
Nice to be here.
Thank you.
So a number of initiatives that we're going to be looking at in September. We're going to have a new webinar in ACE's Truth and Reconciliation series. And we're going to release the findings of 2 national surveys, as well as conduct a social media campaign. Today, we want to focus on those latter 2. And so to begin, Cheryl, we're going to look at the latest national survey that ACE conducted on arthritis and mental health. The findings are going to be released in the first week of September. And for a lot of our viewers and listeners, I think they understand how important this issue is. People with arthritis are more at risk for developing mental health issues because of this interaction or interplay between anxiety, depression, and fatigue with chronic arthritis pain. Our scientific advisor, Arthritis Research Canada, reports, for example, that up to 70% of patients with rheumatoid arthritis experience anxiety, and up to 40% live with depression, and up to 40% of lupus patients experience anxiety, and 30% of them experience depression. This survey went out in May and June of this year. We conducted it online with people living with arthritis. It was conducted in English and French, as all of our surveys are. And it included questions on respondents' mental health and arthritis experience and how they access support and care for their mental health. So as a sort of an introduction, Cheryl, what were the sort of main or chief goals that we were trying to achieve with this survey?
Yeah, so great to be here with you. And as you state, Kelly, this is it's a huge topic in arthritis, and one that is only now over the last sort of 3 to 5 years getting kind of airtime. As Ellen, person living with a form of inflammatory arthritis herself, as well as me, can tell you firsthand. But we don't really think about that interplay between our arthritis and mental health. So first off, we wanted to understand what steps people living with arthritis take for their mental health and what their specific challenges may be in terms of accessing timely professional care. There are people who have both the literacy level, the socioeconomic means, and the health literacy level to deal with some of these mental health challenges themselves, but most do not. And so this is a really important goal of the survey. The other goal of the survey, Kelly, was to identify then those gaps in care that people report on, and how patient organizations like Arthritis Consumer Experts, the organization that we work for, importantly, healthcare providers of all stripes, not just rheumatology, but of all providers that we as people with arthritis interact with, and the healthcare system can galvanize and coordinate and better support our needs as it relates to our mental health and overall well-being. So 2 big objectives: learn more and find out where the gaps are around mental health.
And just a reminder to our viewers and listeners that respondents were able to provide additional comments to any of their answers in the survey. And those comments have provided us, not just with this particular survey, but all the surveys that we've conducted so far, just a much richer background and context and a deeper understanding of what our patients are living with and experiencing. So as we dive into the survey results, First of all, Cheryl, who were the respondents? What kind of demographic breakdown can you provide us?
Yeah, so this respondent pool, first of all of our surveys are anonymous. All of the data is pooled in aggregate, so no one's identity can be revealed. We use the SurveyMonkey platform, which is commonly used, so it's very user friendly. And 258 respondents answered the call to tell us more about their arthritis and mental health. And not surprisingly, these were predominantly women. We know that arthritis affects women much more so than men in inflammatory arthritis, most of them at the rate of 2 to 3. And this respondent pool was much higher for women. It was 9 out of 10. Excuse me. About 40% had RA, 35% had OA, and then there was an equal split of ankylosing spondylitis, psoriatic arthritis, Sjogren's, and some folks with lupus. They had varying lengths of disease experience, which is always important when you're looking at surveys that are crowdsourced like this. You hope to see this spread of experience to learn as much as we possibly can. There were half of the respondents, Kelly, were what I like to call seasoned veterans with arthritis. They were, 10 years plus experience, which would tell us a lot about self-management, self-care strategies vis-a-vis mental health and their particular disease. 30% had disease for less than 5 years, and 20% had disease from 6 to 10 years. So sort of basically 5 to well over 10 years. So, some might think 5 years living with arthritis is an established experience, but it depends on the arthritis. You learn so much. Like some people say at 5, 6 years, I kind of get it now. That would certainly be true for me with rheumatoid arthritis. It took me probably 3 to 5 years to really feel like I knew what I needed to know to lead my life every day with this horrible thing called RA running by my side, We had a small number of respondents who were Black or people of color and Indigenous, which we need to grow that response rate. We're working on that in the next survey because we know that there are significant differences between BIPOC populations and non-BIPOC populations. This was a fairly well-educated cohort, about 60%. Had a college or university degree. About 14% had high school or equivalent education, and well over half, so about 2/3, live in a large urban center with a population of about 100,000 or more. So that kind of gives you a sense, and we're just giving you little teasers of information because in the Joint Health Insight, which is the full report on this survey, Kelly, people are going to be able to read a lot about each of these types of respondent pools, or those that achieve statistical significance in the reporting.
Cheryl, for ACE to understand sort of the bigger picture of respondents' mental health experience, we asked them questions about the conversations they had in their clinical visits with either their family doctor or rheumatologist. What did we learn about what those healthcare providers were asking about a patient's mental health?
Well, I'll preface my answer with sort of these two kind of important points. Healthcare providers, obviously, this is probably most out there in our audience know this, provide different types of care and levels of care. We go to our family doctor first, and we recognize that there are many people across the land who do not have a regular family doctor and have to rely on a walk-in clinic or an urgent care center. That's a whole other issue with respect to mental health care services. But basically, Kelly, family doctors, which is sort of our first stop, right? problem is presenting itself when we're going in for our annual physical, first of all, people with arthritis, there is no standardized joint exam given by family doctors in Canada when we go for our annual checkup. They listen to our lungs, they listen to our heart, they palpate, our knees, our reflexes. They look in our ears, nose, mouth. They don't really examine our joints. And a lot of family physicians are not actually talking to patients about their mental health either, and that would be true for rheumatologists. So a family physician, is the most familiar with the person's overall state of health because that's what they care for. They are supposed to have a level of expertise about a broad range of health issues, whereas a rheumatologist is an expert and has deep knowledge about arthritis issues. And there are over 100 different types of arthritis, so that's a vast amount of knowledge to hold. I'm going to speak anecdotally. For me, my family doctor does ask about my mental health at every one of my visits. She also asks about my sexual health. She asks about my mobility and how my arthritis treatment plan and self-care is working, even though that's not under her, scope. So she's very good at it. My rheumatologist, since mental health and arthritis has become a more prominent topic in the research realm and now out in the grassroots, because it's actually what people with arthritis are talking about. My rheumatologist now is beginning to ask me, how are you feeling? How's your mental health? Do you feel you're suffering? They actually have used the word anxiety, have used the word depression. And in the beginning, people living with arthritis, we don't realize we are actually living with depression or anxiety because we're very wrapped up with the pain and the immobility, the disability, the complex web of decision-making we have to go through in order to climb our way out of kind of misery, for lack of a better way of putting it. So a rheumatologist, because of their specialized care, they can offer deeper insights about mental health and how they interweave with, or how it interweaves with our arthritis. And so two types of physicians doing kind of two different things, but still trying to ascertain where we sit with our mental health. What our survey respondents told us, Kelly, we asked, if they discussed mental health concerns, if the physician asked them, and half said their family doctor hadn't raised the topic. Half. When we heard you cite the statistics yourself at the beginning of this discussion, when the rates are three quarters of people who are diagnosed with a type of arthritis are dealing with a mental health issue, yet half of our family doctors are not asking us, based on this respondent pool. Rheumatologists, 69% said no, they hadn't been asked. So this is pretty alarming, folks, and really rings a bell for ACE that we need to start talking not just to our audience out there in virtual city land, but also to our healthcare providers about the services they're providing and the depth of the conversation they're having with us. Now 33% of our respondents said yes, their family doctor had raised it. Only 19% for rheumatology patients had said that, or respondents said that their rheumatologist had raised it. And then interestingly, 17% said they raised it themselves with their family doctor. So again, that's a really small number, and 12% of our respondents said no, they weren't asked, but they raised it themselves with their rheumatologist. So
thanks, Cheryl. I do have two follow-up questions because this is really important. I think what you've discussed for you, questions for you and for Ellen. First of all, Cheryl, in terms of what you've just described, in terms of our findings and the lack of that discussion, that important conversation being held, what has been the consequences in terms of patients getting a diagnosis for their mental health issues?
Well, you can only address something or take action around or about something if you have the conversation and you have the knowledge. For myself, Kelly, when my family physician, this is after I had disease for about 10 years, and my family physician is the one that actually noticed the signs and symptoms and got me referred to a rheumatologist. So I have been seeing her the entire duration of my RA for 32 years. And it was only until about year 10 when she suggested to me that I might be dealing with depression. Year 10. What would have been helpful to me in the first few weeks is we need to be mindful that this disease comes with mental health consequences and challenges. And I didn't have that. So if we had that, like Fallon and I and all of those out there in viewer land had that information, we as people living with the disease could be vigilant for it. We could watch perhaps for some of our own indications that we're dealing with this. So long answer to a short question, you can't go and seek care for mental health issues if you don't know that it's very common in arthritis. And that's a conversation that has to happen early on in your journey.
So Ellen, we've heard Cheryl talk about the challenges our respondents were facing having the conversation either with their family physician or rheumatologist around their mental health. How has this affected the diagnosis of depression or anxiety with arthritis patients?
Thank you, Kelly, for this question. And I think, Cheryl has touched on it, and it's really difficult to diagnose something that A, we're not aware of ourselves, B, if we're hinting at it very subtly, not in a forward manner to our healthcare providers, they may not pick up on it. Some of them may, some of them absolutely may, but sometimes it may fall through the cracks. And if, we're not aware of it, our healthcare provider isn't picking up on the subtle changes in, for example, our demeanor, how we speak, how we sit, how we hold ourselves, then it's going to go undiagnosed. And when it goes undiagnosed, then we can't treat it, right? If we can't put a word on it, if we can't understand it, then it becomes really difficult to take action to actually solve it. And I think in the long run, that's really detrimental, because the longer that we're living with it and having it add to everything else that's going on in our lives, that becomes, quite a lot.
In terms of the effects mental health has on our respondents' health and quality of life, what were some of the key findings, Ellen?
Some of those key findings, Kelly, may not come surprising to everyone, but I think it's really important to anchor this. And we found that, respondents said that about 50% of respondents said that, they acknowledge that their arthritis contributes to a decline in their mental health. So, there is that connection. People are noticing, and this is great information for us. And we know that females were twice as likely as males to report that their arthritis symptoms were affecting their mental health. And we also know that mental health, about 11% of participants reported that mental health made it difficult for them to take their prescribed arthritis medication. About 55% reported that mental health caused them to either stop or had interrupted their healthy diet or nutrition plan. And about 51%, so both of these are above half, right? So more than half reported that it made it difficult for them to be physically active, to exercise. So again, we really do see it in in those behaviors, those healthy behaviors, those so self-management behaviors that allow us to manage, to thrive, to live our lives with other arthritis because of mental health, right? Like 50%, right, have found that mental health affects their self-care behaviors.
Yeah, and just to add to what Ellen has just said, if you say, well, is any of that different in rural versus non-rural or city living? And there are. That's what we found out in our survey. About half of the people who responded to our survey who lived in a rural community reported that they had been diagnosed, or it had been suggested to them that they are dealing with some mental health issues. And in comparison, respondents living in non-rural communities were twice as likely to say they had not been diagnosed with depression or anxiety. So, city dwellers versus non-city dwellers or rural dwellers, there are differences. So we can't just think all respondents are experiencing the same thing. Financial situation matters. Family situation matters. Location of residence matters. All of these things come into play when it comes to getting help and support for your mental health challenges with arthritis.
So as it relates to that patient journey, which ACE often talks about in the context of models of care, Cheryl, what do you think some of the key takeaways our audience should be considering when they look at our JHI summary report that's coming out in the first week of September?
Well, thank you for that great segue. There is a section called key takeaways for people. So for those who like to go to the last chapter and read it and then start the book, that's what you can do, but we encourage you to read the whole edition. I think one of the most important messages that Ellen and I are trying to share here at a high level before the publication of these survey results is, and we don't want to wait to give you this message because it's so critical. Ask your physician to talk to you about mental health, about your mental health, even if it's good, even if you think it's good at the moment. It's okay to hear good stuff in your clinical visit, like you're doing great, like you seem like you're managing well. Those are things that support us and lift us up to a better quality of life. Too often we focus in clinic on all the bad stuff, which is important, but there's also good stuff. I see Ellen smiling, so I think I've struck a chord in her for sure. It's just good to have the full flavor of life in your visit. So that's the number one message I think we would give right now, Kelly, is just pre-publication. If you haven't talked to your healthcare provider, your physio, your occupational therapist, everyone should be willing to have a conversation with you. And if they don't feel equipped to have the conversation, direct you to a skilled professional in the area of mental health services. Another key takeaway is that there's help. There are services, and we are going to provide those as resources, both at the end of this video, but also in the Joint Health Insight that will be published in the month of September, Arthritis Awareness Month in Canada. So those are the top two things I would say are takeaways. Have the conversation. We're going to support you by pushing healthcare providers to have the conversation, but sometimes we have to meet them in the middle and take charge ourselves, which is difficult to do when you're struggling with arthritis. Maybe I'll let Ellen chime in here.
Thank you, Cheryl. Great, absolutely incredibly important points. And we do, as a patient, have a role in our own self-care journey that we do need to advocate for ourselves. I do want to add, if you know someone else living with arthritis, or if you're listening to this and you have someone in your life living with arthritis, I really encourage you to go check up on them. Even if they seem like they're good, that's great. Like Cheryl said, that's wonderful. That should be celebrated. If they're doing great, they're managing well, that should be celebrated. But I think for so many of us, because it is a chronic condition and we live with it for so long, we underestimate the mental health impact, because it may be marginal, but even if it's like marginal, if it's 5-10%, the improvement we can make, why don't we make it? We've just constantly be at a deficit for so long, we don't know it's a deficit. So I encourage you to reach out to your network. It doesn't even have to be arthritis. Anyone living with a chronic condition, go check up on them. I think that would be my one point.
Yeah, I think that's so bang on, Ellen. And I think we've learned a bit better how to do that over the last couple of years when we've all been sort of so isolated. Arthritis, Kelly, is isolating in and of itself. And mental health challenges isolate us even further. So, the other things ACE does is we do support you in helping you learn how to have the conversation. So if you go to our joint health education programs, you will see kind of lessons there and coaching videos on how to have a better conversation or a conversation with your healthcare provider. Sometimes we just need to brush up on our skills on chatting with our healthcare providers, being super focused, going in with conversation goals, actually measuring in the visit during the conversation whether your questions are being answered. Those are just really fundamental communication principles that will help both parties, provider and you, in the process of talking about your mental health. We're also going to support you by spreading these findings far and wide through social media campaign in the month of September. So we'll look for those on our channels on Twitter, Facebook, and Instagram. And I guess the last thing we would say is please share them with your network. Whether they have arthritis or not, I guarantee you they're going to have another chronic disease or condition. So these things are not just about arthritis. They're about our whole body health, physical and mental and emotional.
Well, thanks to you both for taking us through this really important work that ACE has conducted, looking at mental health and arthritis. And certainly it's a topic that our members and subscribers ask us on a regular basis, which is one of the reasons why we conducted the survey in the first place, is to respond to what our community is looking for and what they want in terms of information. Also a reminder that in September, during Arthritis Awareness Month, we will be releasing the findings of our survey on health inequities. There is an earlier Arthritis Home episode where we talk about this survey, and it will be completed in the end of August. And we will be publishing those results during Arthritis Awareness Month, so our viewers and subscribers can look forward to getting information about that. And I think also, just to underline what Cheryl has mentioned, Ellen, you're going to be responsible for the social media campaign during Arthritis Awareness Month, and it will be focusing on our national surveys. Is that correct?
Absolutely. We'll be focusing on the mental health survey and then the exercise survey, and the way we're kind of presenting it is, little summaries day to day of what we found and how we think we can take action on them. So, please engage, participate. We are so excited for you to be a part of this.
We want to thank all of our survey respondents. Without your direction, we couldn't do what we do. We wouldn't know if we were doing the right things or at the right times or on the right topics. So we really want to thank all of our survey. You know who you are. We don't know who you are, because the anonymity is assured when you're taking our surveys. So just a heartfelt thanks from all of us that are Arthritis Consumer Experts for participating in our survey program throughout the year. We really encourage you to share future surveys with your network.
And to just reiterate on that, we want to thank you for watching this episode of Arthritis at Home. Lots to look forward to in terms of ACE activities coming up in the month of September during Arthritis Awareness Month. Ellen and Cheryl, thanks very much for joining us today.
Thank you, Kelly.
Always a pleasure.
Thank you, everyone.